Welcome back, guys, to episode 17 of the weekly podcast, Scrubbed In. For today's episode, we're going to change it slightly and talk about something perhaps not as exciting as before. So we're going to be talking about our first ever death. And it's important that we mention, if you're not a big fan or you're not too fond of hearing about such things, we're more than happy for you to skip this week's episode and wait for next week's one. But death, certifying death, seeing your first ever death as a junior doctor is something that medical school definitely does not teach you. So let's just get straight into it. Tell us about the first death you experienced as a doctor.
You know what? Looking back, right? Med school only teaches you how to save lives.
Yeah.
Teaches you ALS, BLS, all of those things where if someone's deteriorating, what can you do? What can you do? What can you do? But never about death, right? My first ever death was during ward round. We were on the ward round. I was with the consultant in another complete bay. Suddenly the alarm goes off. When the alarm goes off, your heart rate starts to jump already because now you know someone's in significant trouble. The arrest bell. So I ran over. The most comforting feeling at the time was that someone more senior was there already before me. Okay, but you're obviously there doing everything. This lady, she was on the commode and then she was put into the bed because she arrested, and we're doing CPR, we're getting oxygen into her, we're trying to get access, and there was quite a few individuals there, and I was given the task of get access into this patient, right? So I was there trying to cannulate this patient, trying to get the needle into a vein, right? You have to remember when someone's arrested, their veins and peripherally, they often just shut down.
So the
there's
body's
no
shutting down.
And in my head, there's adrenaline going through me because I'm thinking, if I don't get this in, we have no access, we can't get fluids into it, we can't get medication, it's my fault. It's my fault. And I remember thinking about that. This will be my fault. I couldn't get in. And there's other people trying in several different limbs at the same time. No one's getting access. And I remember feeling like, why can't I do this? Why? This is important. Adrenaline going through me again. I'm going absolutely ballistic inside. And I remember the room was, for me, on fire. And then in the end, one of the anaesthetists literally shoved me off and put in an interosseous, which is into the bone.
You did the interosseous, yeah.
Not myself, so the anaesthetist just put it straight in, and then we had it going in. And then the rule is the 4 H's and T's, which is the checks that we go through. And she didn't survive, man. She didn't survive. There's quivering in my voice talking about this. It's weird. I'm quivering.
We've never talked about it,
talking about death. It was my first step, and I remember I didn't want to work. And I walked away, consultant, Reg and everyone, they obviously they've seen a lot of deaths, they've managed it, they've almost gotten used to it in a sense. And I was there shocked as the FY1 who's just started. I'm the only F1 there. I have to do all the jobs from the ward round. And I was just shell-shocked, absolutely shell-shocked. My Reg saw it and was like, you need to take a break. Just go and take a break. And I was shell-shocked, and I went to the bathroom, right? And I felt sick, I felt nauseous. I was like, what could have happened if I got access into her earlier? And then I was thinking things like, but what if the day before, if we had done this, could we have prevented? And you start thinking so many scenarios where, is it your fault? Right? Is it your fault? That just runs through your mind. And I think emotionally it's so enduring, it's so exhausting mentally to go through it. I remember it as clear as daylight. What about you? What do you think?
Man, there's a few deaths I want to talk about, and obviously after a year you've seen a fair few, but I just want to talk about the ones that kind of hit me or it left a big impression with me. So one of my first few deaths, but the first one was an ITU death. So it was a 61-year-old gentleman who he came into hospital. He had a fall. He was in resus in A&E. With dropping blood pressure, in and out of like consciousness. And I'll kind of cut to the chase. He essentially had a splenic rupture. He had about 4 to 5 liters of blood pooling in his abdomen. So obviously he was deteriorating very badly. And it was me and my consultant. And I remember him despite being in and out of consciousness, he was one of the most pleasant men I've ever met in my life. And he couldn't communicate. So in medicine, for everything we do, we always need consent. So if I was to take bloods of Amz, like Amz, I'm going to take some blood, or I need to do this and this. And he just smiled and he used to put his thumbs up. And I do the thumbs up thing. So at the end of a ward round, or when I'm leaving the hospital, I'll go around and I'll put thumbs up to all my patients, make sure they're doing all right, and then I leave. And he did that, and it hit with me for some reason. And he's just like, yeah, do it, whatever. And we were doing the most. We're giving him blood transfusion, prepping him for surgery. After surgery, he went into ITU. ITU, obviously, he had like low platelets. A lot of medical things happened to him, and we're taking blood off him, putting lots of different lines in. And ITU, for people that know it, is essentially where we're looking after your organs for you, but it means there's loads of pipes going into you. There's, if in any way possible, we're just monitoring it, and it's not a pleasant place to be.
Not at all.
And every time I go in, he just put his thumbs up, and he's like, do whatever you want, and like, you know. And there are people that, you know, they don't even like taking blood. And then there was that one night where he was struggling to breathe. His respiratory rate was dropping. He ended up getting sepsis, and he just passed away. So the next morning, when we came to a ward round, we came to see him, and all you hear is, you know, he's passed away. And that hit me, man. It just like, because for me, it was like he was on the verge of death. Luckily, we went in, saved him, sorted out the spleen. So we took out the spleen, sorted him out. He was recovering.
Yeah.
So the problem with this death was he was recovering and doing so well, and then he suddenly deteriorated and passed away. That got me. Not the fact that, all right, his prognosis is poor, we couldn't go in, we couldn't operate on him. Okay, there's a high chance of being the chance, and he was about to be stepped down to the ward, bro. Do you know what I mean? Stepped down to the ward that night, respiratory arrest, and then he unfortunately passed away. And the next day, and you get to know the family.
That's what it is, man.
And it got me, man. And I like, he was, and the bit was like, do whatever you want, and he just put his thumbs up, and he's like, yeah. And I did a manual evacuation, which I don't want to talk about on camera. It's essentially he couldn't pass stool, open his bowel, so we had to go in and manually remove things. Like, and he was the most pleasant man, and it just murked me even to today, man. It gets me.
You know what you touched on there, which is quite important, and for all the medics in training, or the aspiring medics, or the current medics now, you'll find that as doctors, you build relationships, and they become your own, like your own mother, your own father, your own uncle, your own brother, your own sister. And seeing them deteriorate like that is when your heart breaks, because they're like, it's like watching your own uncle, father
so
deteriorate. You're right.
Yeah.
All right. And it's one of the hardest things, because emotionally, medicine, as part of school, maybe they're starting to do it now, but I didn't find that. I was trained in that way. That resilience to still be able to stand strong. Because let's be honest, a death can affect you. It can completely derail you. You might not want to come back to work the next day. It
takes a hit. And I remember, like, it's not a death, but it may count as a death for some people. So I was in gynae, and we had a lady who came in, a 40-something-year-old lady who, the background is, she's 41. She had IVF pregnancy before, had 2 twins who passed away. So this was her kind of second and last time of having a baby. And she came into A&E crying of abdominal pain, lots of bleeding from down below. And obviously she was pregnant. And one of the, as you probably know in A&E, the first thing is like, is she having a miscarriage? So she was having an active miscarriage. So essentially she was pushing out the fetus. And it was around 17 or 18 weeks, if I can remember correctly. So when I went in to examine her, and basically with an active miscarriage, they're pushing out the fetus, or what we call fetal products, and you're basically removing it. And I remember I went in, and when I opened up, I essentially saw a fetus this big, literally the size of this. Imagine the textbooks images you see or in science, you know, that it basically resembled a very, very small baby. And it literally was there with the umbilical cord attached. And I remember, so obviously she lost the baby, and she was screaming and wailing, and the whole A&E, and that was basically I lost it. Like, I had to leave, me and the nurse, because I've never seen this anything before. Bear in mind, we've only been doctors for a year. Neither had the nurse, or never seen it in this situation like this, where the whole fetus is out in one go. And I had to take a break, man. It messed me up. And like you, it's like you don't want to do anything. You just want to go home that day. It messed me up so much. I couldn't stop thinking about it. And I came and I had to, like you said, and all the episodes I started to tie in, like I had to get off my chest, man. I remember I spoke to, called my cousin. I was like, bro, look, just listen, hear me out. Don't say anything, but I just need to tell you what happened. I need to get off my chest. And that kind of, I can imagine suggesting would be a death, because it was the loss of a fetus, and it psychologically, it kind of affected me very bad, very deeply.
Exactly.
And every time I go past that bay she was in, I still remember it, man. So
and you know what, coming back again, it's beautiful how these episodes are tied together now. One of the senior doctors did notice that I was clearly shell-shocked and was trying to do whatever they could to sort of support me in any way. And I think as doctors it's important, as medics it's important. There was a study for medics especially, showing that they were at higher risk of developing mental health conditions and depression and things like that, right? And death is a serious risk factor. Coming across death like this, think about how you felt, how I felt in that situation. You can completely derail again. So it's important we're supportive with each other, especially with that. Did you get any support?
Yeah, I spoke to...
So you had your cousin who you called up. So
yeah, and it was the nurse as well who saw it. Sometimes when you experience, because I experienced it with her, so I was basically removing the product, and you send it to the labs with the permission to kind of test and see if there is any cause they can find as to why the mother had a miscarriage. And me and the nurse, we kind of support each other, and we took a breather in the storeroom, and we're like, that was like, you know. And the thing with medics is you have to act strong and know what you're doing for the patient.
Yeah.
And it's a very difficult
because
place.
They deserve it at the same time.
Yeah,
they need someone.
They need someone that's calm and collected and managing them. Bear in mind, her blood pressure is dropping, and we're trying to infuse her. Do you know what I mean? Because she's bleeding a fair bit. So you don't even get to not grieve, but you don't even get to understand the full thing properly because you're in this work mode at the same time. So it's this thing, like you know, when you said the room was on fire. It's like I need to sort her out. I've just seen something that's crazy. I've never seen this in my life. At the same time, I need to stabilize her. Otherwise, she's going to bleed to death. Do you know what I mean? And even, by the time you've got over one thing, you're sorting another thing. And she might need surgery, or I don't know if there's retained products of tissue inside. So luckily, I had my cousin who was the first person I saw my friend called him. And the nurse was there. Why
did you call me, man?
Bro, he was there. He called me. I called him straight. But I think I told you. I don't know. I told you, and I told everyone. As soon as I came that weekend, I told all my friends and everyone. I had to get off my chest, and it's like I had to tell people because even now I'm in shock.
Did you find this hard? So one thing I found, right, is after you experience that, right, you have to remember also the need of you staying strong for the person you're also treating, because they're also deteriorating. Yeah. The next patient who knows nothing about what you've experienced, what you've seen, what you've been doing, but you have to. They also they deserve it of the best care. They deserve to have the best version of you, which is the strong, resilient, knowledgeable doctor. Right? Did you have any difficulty when it came to the next patient you saw? Did the emotions of the previous case affect you?
Luckily for me, at that point, another SHO, another junior doctor who's a few years older, came in, and I just said, "Listen. So what we do, we cover A&E. So when there's ever a problem that concerns us, we get the call." And the next call came in, and I said to the lady, I said, "Listen," to my colleague, I said, "I can't do this. I need a break." And luckily she was there, so she could cut the pieces.
Okay.
But like you mentioned, I'm sorry, if I had to go see that second patient, I wouldn't have been thinking correctly. And I don't think as a doctor it's safe for me to be in that environment. So I just told her, "You know what, do it." And she's like, she saw it and she knew, and she's like, "Yeah, just go, take a breather, take a 5-minute break, come back." And she went and saw the next patient.
I think
so that saved me. Because I know, like you said, it will. You know, I'm not sure if you experienced it, but
no, I
you have to be on with the rest of your day. To be honest, man.
Yeah, but again, like you, so this is. I think we're highlighting good things that's in our environment, which is our seniors or our colleagues. Sort of taking the baton when we can't hold the baton at the current time. So similarly, I missed in terms of the ward round. They saw 1 or 2 patients, and then I rejoined them. But I think that's a very wise piece of advice that you've given, which is that when you feel that you aren't at your best, take a break, tell someone, or because that will allow you to process everything that you go through, especially death. As we said, med school does not prepare you for death. And so if you need that time to process it, because like we said, the next patient deserves the best version of you.
Yeah, and you need to look after yourself, and you need to make sure you're thinking well and correctly, and they need you. The reason as to why they're in hospital.
Exactly.
So you need to be thinking straight. So those were two other things. Is there any other deaths you remember in particular?
It's that. Do you get the feeling of? So, as a doctor, obviously, we feel like we can do everything.
Yeah, I have a death
But
like that.
some cases they're just inevitable. They're inevitable. You just cannot do anything. You're pumping through fluids, blood.
You're doing everything.
Doing everything possible, right? And your heart's racing away. The numbers aren't improving. The obs aren't improving. No matter what you do, the defibs on. You're shocking them. And do you ever just zone out and get tunnel vision and just look at it and think, why can't we do it? Do you ever get that sensation of that invincibility that we think we have, that we're told to believe we have, isn't actually there?
So touching on that, this superhero complex that medics have.
Yeah.
I learned a very valuable lesson.
You told me about this one.
This death happened in one of my first set of nights. Not one of my first, like when I was in the medicine rotation, I was on nights, and I had this. So as the months go on, you become a bit more confident. You know your own calls, and you kind of learn how to manage things. So I think in a way it was good. It kind of humbled me to a certain degree. I had a patient on the respiratory ward, known COPD, community acquired pneumonia, who wasn't doing too great but was stable. And all of a sudden, I got this bleep. So I got a call from the nurses saying, doctor, can you come and review this patient? He doesn't seem to be doing too well. And bear in mind, I'd seen him like an hour or two earlier. He was fine, and they're saying his saturations are dropping. So essentially, the amount of oxygen he's got in his body was dropping, and it was dropping very rapidly. And despite during the first steps, he's basically putting on a mask with 15 liters of oxygen, smashing it in, propping him up right, doing all the things, it wasn't improving. The key thing in this was he was deteriorating, or his saturations were deteriorating very rapidly. So I came and I saw him, and I'm like, the superhero guy. Bear in mind, I've only been a doctor for 8 months, and you get this peak where like, oh my God, I can manage anything, and you're there, and I'm trying to manage him, but nothing's working. But I haven't done medicine long enough to start thinking very laterally, and I'm thinking, is it COPD? Is it a pulmonary embolism? Is it a blood clot in the lungs? Is his infection being exacerbated for something? What's happening? And I'm trying to sort it, and it's deteriorating, and then it got to a point where I called my reg, so the registrar, who's a middle grade doctor, a lot more senior, and I said, yo, this situation come up, and first thing he said to me, he said, why didn't you call me earlier? Why didn't you call me at this point in time? And I was like, I thought I could manage it. He's like, no, the reason why I'm here is me. And he literally dropped what he did in A, and he came and saw us, and we're both trying to essentially resuscitate this patient. And so we're getting this emerge, you get portable chest x-ray, finding out what's happening. We don't know what's figuring out. And then while the patient was deteriorating, and I learned something, he's a consultant now, he basically said, call the family, tell them to come in. This patient ain't going to do too well, and I don't know if he's going to make it or not. And I'll tell you what happened with this consultant a few days afterwards anyway. And we saw the x-ray, but you can't really see anything on the x-ray. It looks normal. And then he was like, this guy's got a mucus plug. And the thing with a mucus plug is essentially there's a clot in the lungs with a mucus plug from the secretions and whatnot. We couldn't clear it. And he said one of the reasons as to why someone deteriorates that bad is if they got a mucus plug in the lungs, and you can't really do much about it. And he ended up passing away that night. And the one thing I learned, or handful of things I learned that night, was regardless of who you are, don't think you're a superhero. You may have done things lots of times, but there is support for you. And this thing is like, some death is inevitable. Like, you're going to lose the patient. There's not much you can do. It's sometimes a bit too late. You can do your best. Always call for support. And one thing I learned from him, and at King's, personally, I think they teach us this very well, is communication skills. 100%. He had excellent communication skills, but he had excellent communication skills not only with the patient but with the family. A lot of complaints in the NHS, in hospitals, happen because of poor communication. So from the statistics, the main reason as to why loads of patients complain, loads of people are unhappy with the service, is because there's a lack of communication. Or ineffective communication. So that's something to be mindful of. And he had this practice, so we do a set of nights, so you do like 4 nights in a row, and I worked with him, and every time a patient was deteriorating, he would always call the family, he would always call the family tell them to come to see them and say, look, you're it's always the parents. Your parents ain't doing too well. I think if you want, you can come and see them. This is the situation. He was always honest and direct, and I learned that the importance of communication. And doesn't matter if it's morning, night. I think families appreciate knowing that. I think there's a tendency in medicine to kind of not say exactly what's happening
because we think we're gonna be the superhero. I guess.
So I think that death was a learning curve for me.
Completely, man. Talking about death is even it's draining, man. That death, I think, at the same time, I always want to sort of stay in tune with how my emotions are, because I don't ever want to become desensitized, because I think it allows you to feel what it feels like, and you get to there's a bond, and you understand how the family around and everyone is feeling, which you can hopefully process quicker and then be a form of support.
I think saying that, naturally, I know, and I know it's bad, I feel that we will become very desensitized to death, even at home. And the funny thing is, when people come to me or say like, I've got this pain here, I've got that pain here, because I'm so used to seeing people on the verge of death, because I'm so used to seeing people so bad and so deteriorating that normal things like a cut or bruise or grey, it doesn't affect me. And I'm like, listen, I'm being called to see people who complain they can't breathe and they're holding their neck. And they complain your chest tightness, your little cut and bruise. But for that person, that is a big thing, because that's their pain.
Exactly.
But the problem is we're so desensitized, or rather the word sensitized to all, it doesn't affect me. So I think...
But I think what it is that maybe I've not chosen the right word, but I want to always understand what it feels like for the surrounding people and for the patient.
So it's empathy, innit?
Yeah, exactly.
So putting yourself in their shoes, and I think it's important as a doctor to be able to be. It's one of the key skills you need for medics or prospective medical students. If you want to be a good doctor, I'd say develop your empathy skills. In essence, putting yourself in someone else's shoe, because we're used to it, we see on a regular basis. But for that person, that death is that death. That is their mum. That is their father. That is a close and beloved relative for them. So I think it is important that we always remain conscious of death. I know some people may wonder, how does the process work of death as a doctor? I know we've talked about experience, but do you want to explain how it works? So like, someone passed away and I'm the nurse and I'll call like, Dr. Chaudhry, do you mind coming and sorting this out? So what does that process entail? How do you feel?
So when you get the call, your heart drops straight away, because it means it's a death that you're going to deal with. And I think then you go to certify death. When you go to certify death, you're looking for signs of life, checking their breathing, checking if they are breathing, checking if they've got a pulse, if they've got a heart rate, if you can auscultate anything at all. Essentially just doing a check over
signs of
life, and then you just document.
So how do you feel that the first time I did that, I didn't know how to do it? So the first person I had to certify death on, I had to go geeky medics and learn it, because you do it in proxy, but medicine teaches you, but you never do it. You're not going to be certified deaf as a medical student. So the first time, and it happens to be on nights. Like every time I was on nights, I was certified deaf. It's a weird experience, a very surreal experience, because I don't know how to put it in words. I don't think you can ever put it in words. Certifying deaf, it's just a bitter moment. It's a weird moment.
You know what? When I did my first 1 or 2, right? It was one of those things where I was also very cautious, because it was like, once I say there's no signs of life, it means there's no signs of life. So I would be there with my stethoscope, and I was there for a very long time, and I was like,
I know what you mean.
The interference from my stethoscope was causing noise, and in my head I was like, but what if that was their heartbeat? So I was there for a very long time. I got the nurse I was like, here, put the stethoscope on, can you hear anything? My first one was very, very, very nervy. I was just literally, I was there with the stethoscope on, and I could hear interference from the stethoscope coming through. So then I just sat and just made sure there was no dual sounds or any pulse, any heart rate or anything like that.
The first few, I like that, isn't it? You don't know what you're hearing. Sometimes you're hearing your own heartbeat. Sometimes
exactly, and my heart's pounding away. So I'm just like, and in my head is, once I certify death, I've certified death.
That's death.
So I better be right.
Yeah, it's weird. And I remember, it's the ones in the side rooms where you go in the dinner room, and now we're a bit normalized, and I know what I'm doing and I know what I'm looking for. But the first few were a bit weird and surreal, and I didn't know. And the way it works, you have to call out their name, and you have to kind of push quite firmly on certain regions of the body to elicit pain, which kind of elicits a response afterwards in a normal individual who's alive. And those things I find it weird. I find it very disrespectful, and sometimes.
But the thing is, you have to do it, because what if they respond to it? The pain reflex.
I appreciate.
That's
do you do this thing where you like you put them in a very nice way and you put the covers up? And
I always, because that's respect. That is respect.
The main thing is that's so important for me, and like you just want to, and it's like you do everything very softly, very nicely, very correctly, and then you sign the certificate on the notes, and then you move on. But the first few was a very weird and surreal experience. I agree. I didn't want to make any mistakes, and I remember I read it again, made sure I certified at the right time, the right day,
exactly
who was the witness, and filling in all that information. That one was a bit tricky for me.
And then I guess the next thing we have to do as doctors is then fill out the death certificate for the family, and that's essentially writing down the details of the death and the causes. The causes of death. I think that's the main bit. I think that's more of the formalities, making sure you can ask the consultant. I think everything before that is where you're like the main person doing everything. That's the bit that really shakes you up. You're right, it completely shakes you up. Even talking about it, I think we haven't been doctors long enough to be just talking about it. But yeah, that's about it, I guess, isn't it? Can you think of anything else that you want to discuss about this?
It was more a somber episode, but it's the reality of life, to be fair.
Exactly.
And I think it's good to talk about it, and it's probably a good experience for people that may not know how the process works or may not know the insight. So on that note, I think we'll call it. Once again, an immense thank you to all the people that have been supporting us and sharing it. We hope you found some benefit in this episode, but it's just good for us to kind of get off our chest and talk about it.
Exactly.
And if you do want to reach out to us, if you are struggling or want some advice or need someone to talk to, me and Amz are more than happy. We're here.
We're only a message away.
So give us a shout.
Only a message away.
And on that note, we'll see you next week.